What's up, everybody? My name is Felino and I'm a flight nurse. Thank you so much for coming to the channel, and in this video I'm going to help you become a flight nurse as well. So I get questions a lot on my TikTok and now on my YouTube about how to become a flight nurse and what experience you need. If you haven't already, please like and subscribe to the channel. This channel is actually getting some traction thanks to you guys that are so curious about the job, and I'm going to help you today. Now, this is all coming from personal experience, and I've actually helped a lot of nurses become flight nurses with my advice. But every job is unique and requires unique requirements, but this is a general idea. So let's go into the resume. So I'm going to pull up here a regular resume for a flight nurse. This is for a certain company, but most of the requirements are the same. This first requirement here, the required qualifications are probably the bigger ones. So graduate from a accredited school of nursing. So in order to become a flight nurse, you have to be a registered nurse. Just get that out there. The big one here is the minimum of 3 years of recent ICU critical care or emergency nursing experience. You can start off as a new grad in the ICU or in the emergency department, but what these flight companies are looking for is the acuity of your ICU and emergency nursing experience. What I did, I was in a level 2 ICU for about 3 years, and I needed more experience, so I went into travel nursing. And with my point in travel nursing, I wanted to get into level 1 hospitals with higher acuity because that's what they're looking for. So I worked for level 1 trauma hospitals in the ICU, and I even floated to the ED. From clinical educators' perspective, kind of a best looking flight nurse is a flight nurse coming from the ICU with ED experience sprinkled in. So like a float or something like that. Now it also says a minimum of 3 years. So I applied with 4 years. I applied at my 4-year mark and I was still getting rejected by all these companies. I applied to about 7, 8 companies and only got a handful of interviews until one actually gave me a shot. People are applying with 3 years, but they're also competing with nurses that have been nurses for 5, 6, 7 years. So it's really hard to get the job right at the 3-year mark. But I mean, it's worth a shot if you apply, especially if you come from a really, really busy hospital. Notice that it doesn't say pediatrics, labor and delivery, or NICU experience. In flight companies, they actually train you to be proficient in pediatrics and L&D and NICU, and you don't necessarily need pediatric experience. I didn't, and they'll actually train you to become proficient once you're hired. They understand that a lot of nurses come from adult ICU or emergency departments, so having knowledge in it from your nursing school is great, but you necessarily don't need pediatric experience. So now let's say you become a nurse for 4 years, you got your time in the high acuity hospitals. Now it says here license and certificates. So of course you need your BLS and your ACLS if you're working in the ICU and ED departments. That's kind of required already. And your PALS. So PALS is the pediatric advanced life support. So that's also a good one. Even though you're only working in adult ICU or ED, PALS is a requirement. So I would actually get that even before applying. You just sign up for your local classes, for your PALS classes, or your hospital might provide it. That will set you up for your basic certificates you need for flight nursing. Also a good one to get before applying, even though a lot of flight companies actually give you the certificate and provide the training for it, is your NRP, your neonatal resuscitation. So getting that before you even apply is a big step into your resume, and it gets a lot of points and gets a lot of eyes on it. I was like, oh, this guy's experienced, or at least knows something about taking care of babies. So other certificates you need, and these are really important. And if you want to get into flight nursing, especially in the helicopter, we deal a lot with traumas. So we go to scene flights, we land on the highway to a major accident, and we take care of those patients. So certain certificates are trauma certificates that you really need to be on a flight team. So it says here TPATC, TNCC, PHTLS, or ITLS. So these are trauma certificates. A lot of trauma ICU nurses get TNCC, which is very good. PHTLS is also good as well. And this is actually pre-hospital trauma life support. And a lot of paramedics have this, and your partner is going to be a paramedic on the helicopter when you're a flight nurse. So getting these two certificates, I applied with TNCC, and then I got my PHTLS like a month into my flight nursing job. Now, like I said earlier, different flight companies that are very unique, such as hospital-based or NICU teams or heart teams, they require other certificates that are like ECMO or special like heart monitors. So those certificates also help if you're applying for those kind of jobs. Now, the next one here also says current specialty training or willingness to let you train in all these certificates: NRP, FEMA, NIMS, 100, 200, 700, 800, and hazmat training. When you're hired, they usually provide you that, but the FEMA 100, 200, 700, those are free and they don't expire. So you can take those even before you apply to the flight nursing, and that will look good on your resume. And those are really good. And if you're a flight nurse with certain companies, you can actually deploy to FEMA deployments and help with emergency responses in that area with a disaster that just occurred. For example, for me, I was part of hurricane relief efforts, and it was really nice. It was about 300 medical professionals, mechanics, pilots responded to hurricane relief, and we were on standby. If the hospital would lose power due to the hurricane and they needed to transfer patients out, we would be that help. So another really cool thing I love about flight nursing, it's not just a routine of like a 12-hour shift. One day I could be at my base, or another day I could be responding to a disaster relief, or I could be anywhere in the country doing my job. And that's helping people, which is awesome. Now we're moving on to the next part. Pre-hospital BSN or bachelor degree is preferred, but if you are actually have an ADN and a registered nurse with these qualifications, one of my really good friends, she was a flight nurse with an ADN. So you necessarily don't need a bachelor's in nursing to be a flight nurse, but it is preferred. So for the pre-hospital experience and flight experience, if this is your first flight nursing job, of course, you're not going to have the flight experience. But what you can do to get the pre-hospital and flight experience is what we call ride-alongs. Your partner is going to be a paramedic, and they're used to pre-hospital experience, right? So what you can do, you ask your local EMS, ground EMS companies, if you as a nurse can do a ride-along in their trucks, which I'm in an ambulance every time I work, even though I fly in helicopters and airplanes. So, and then for the flight experience, you can ask your local flight companies to do ride along. So you necessarily don't have to do patient care, but you can see how flight companies work, and you're just kind of in the background, kind of almost like a precepty, watching these nurses and paramedics work on the flight team. Now, really, really big one, and a lot of ICU nurses have this, is their CCRN. It says here specialty certifications such as CEN, CCRN, or CFRN. So emergency nurses, your CEN, you need to get that. Your CCRN, ICU nurses, I recommend you do getting that. Your CFRN is a certified flight registered nurse. So you can get that within the year of you working as a flight nurse. So that's not really required. But if you do want to study and take the test and you do get that certificate, that's awesome points on your resume. It says preferred qualifications, but it's mostly you need it to apply. It kind of shows the company that you are knowledgeable in the critical care setting, even without the flight experience. So we went over the preferred qualifications and the license or certificates. Now, from my personal points, there's other hidden things that you should know that's not listed on the requirements here. Nurses should also know when they get the interview for flight nursing is burns, how to treat them, the calculations you need, and OB transfers. So high risk OB, like a mama's about to give birth in the plane, what do you do? Or emergent deliveries kind of thing. It kind of correlates with trauma and hemorrhaging. So OB burns are really good to know for your interviews. It's almost like all this stuff in nursing school applies to flight nursing. Isn't that crazy? So now you're in this interview. You got your burns, you got your certificates, you pass all the clinical questions. We're looking for in flight nursing, and if you're my partner, is safety. So safety is paramount in this job. Now, I'm not going to lie to you. People have died on this job from crashes, but we practice so much safety and so much safety checklists that it's a pretty safe job. On your interviews, they're going to ask you some kind of, they're going to put you in situations where it's unsafe, such as like a patient is in somewhere that you need to fly to and the weather is bad. Now, you can't get your judgment that you want to help someone so bad that you're going to put your own life at risk. We have a saying in the EMS world that we all go home. So they might give you that situation and you're going to say, if it puts the crew and me in danger, it's not worth it getting that patient. They're actually safer in that hospital they're in right now. Or you can ground transport them and not risk flying a helicopter or airplane in bad weather. Now, a little tidbit here. It says, as a member of clinical flight crew, any person employed in this position shall maintain a weight that not exceed 225 pounds. They're not trying to kind of body shame you, but it is a safety issue on the helicopters and a patient issue on how much patient weight you can take if you're over 225 pounds. The weight imbalances in the helicopter, they can't carry a lot of weight, surprisingly. You actually need to weigh less than 225 pounds. Now, on the airplane side, it's a little bit different. It kind of doesn't matter at that point on the airplanes. Airplanes can take a lot of weight, but definitely on the helicopter EMS side, weight is very important. Another point on that, the job is very physical. The companies are not going to put you through like a physical fit test, but you do need to carry bags that weigh about 40 pounds on your back. Some companies require that you're able to lift 45 pounds up to your chest or above your head. Overall, we are carrying bags. We are lifting patients. We don't want people getting hurt. So you do need to be actually physically capable of doing these things on patient transfers. So now that you got the interview and all these certificates done, I hope you do really well in your journey on to get to flight nursing. You can always DM me on Instagram for help on your actual interviews. Now, I thank you for watching this video. I hope it does help. I know it's short and we went over, just kind of skimmed over the resume a bit. Like always, like and subscribe. Thank you so much, guys. I cannot thank you guys enough. From my TikTok, now to my YouTube, now my Instagram. You guys are so amazing. I love you guys. You guys show me so much support. I just can't believe it. And not that I can help patients, but now I can help other nurses become flight nurses. It's so surreal. You guys are amazing. Love you guys. Check out the next video. You guys are